Hello, I am Dr. C. Rao, Consultant Diabetologist at WISE Diabetes and Research Center, Fatima Nagar, Pune. Today I wanted to discuss about an important topic of heart disease in diabetes. There is a very strong link between heart disease and diabetes. In diabetes, uh, almost 75% of deaths in diabetes, type 2 diabetes happens because of heart disease. So it's very important to understand. In Indians, what we see is heart disease occurs at least 1 decade earlier than in a Western population. In Indians, it is more aggressive, it is more widespread. The arteries of the heart, the more arteries of parts of the arteries are affected, and so this leads to higher chances of complications related to heart in diabetes. So, if you look at the cardiovascular system, there are the arteries of the heart, the arteries of the brain, the arteries of the leg, all may be affected in diabetes. So, it is a diffuse involvement in type 2 diabetes. If I have to speak about diabetes, there are many types, more than 100 types of diabetes, but the most common is type 2 diabetes in India, which is what we see commonly related to age, related to obesity, family history. This is type 2 diabetes. Then there is type 1 diabetes, gestational diabetes, and other rare causes of diabetes. But type 2 diabetes is most common. We will discuss about that. Type 2 diabetes is also associated with blood pressure and high cholesterol. So all three are linked. It's a triangle of diabetes, blood pressure and cholesterol. All three are linked, and mainly they are because of obesity. The cause for all these three issues is obesity, especially central obesity, which is we all know, which is because of the poor lifestyle that we are having now. We are having very high junk food, very high calorie food. We are having very less exercise, physical inactivity. All this leads to weight gain, which eventually leads to diabetes, blood pressure, cholesterol, and also smoking nowadays in many of the patients, and all this contribute towards heart disease. So these are all risk factors for a heart disease. Now if I have to discuss about the heart, now you can see there are big arteries which supply blood to the heart muscle. Heart, if you see, heart is a pump. It pumps blood, and this blood vessels surrounding the heart supply blood to the pumping heart, because the requirement of heart, the pumping heart requirement of energy is high. So these arteries supply the energy. Now in diabetes, what happens? Diabetes, blood pressure and cholesterol, there initially the big arteries of the heart, the internal lining of the artery, this is known as endothelium. If the glucose is uncontrolled, now this is very important to understand, if the glucose is uncontrolled, blood pressure is uncontrolled, or cholesterol is uncontrolled, they start affecting the arteries lining, and slowly there is a buildup of plaque or fat, that is cholesterol deposit here. And as it goes on increasing, the flow rates, the blood flow pressures and flow change there, that leads to sudden artery occlusion later on and cause a heart attack. So you understand the risk factors for these blocks are uncontrolled diabetes, uncontrolled blood pressure and cholesterol, and smoking. These are the risk factors, and of course family history. Those who have family history are more prone for these artery blocks. So all this lead to artery blocks at different levels, which may lead to an heart attack. So the important point what I want to make is, if it is uncontrolled, we get a problem. If these three issues are controlled nicely, sugar, blood glucose, blood pressure and cholesterol are well controlled, the chances of getting complete heart attacks is very less. This is the important statement. Now we will look at the symptoms of diabetes and heart disease. Now I always tell my patients, the most common symptom of diabetes or its complication is no symptom. In most of the patients, these are silent. In fact, diabetics are known to have silent heart attacks. So symptoms can be very misleading in diabetics. But common symptoms what we say is chest pain. It's usually retrosternal or behind the sternum here. Many times it's after walking. After walking, the patient will feel heaviness or chest pain, which may be radiating to the arm or on the back, sometimes on the jaw. So many patients will pass it off as acidity. But again, when you get breathlessness or chest pain on exertion, on walking, we need to first rule out a heart problem. So chest pain on walking, breathlessness on walking. Sometimes after eating there is heaviness on the chest. These are the symptoms which indicate there may be a heart issue. And what we do is, whenever patients complain of this, we get a ECG done, or much better is a stress test, that is 10-minute treadmill test. Patient has to walk on the treadmill. We make the heart work more because of the exercise, and in that, when the demand on the heart increases, we look at the circulation, we get an idea of the circulation through the ECG. So stress test is very important in diabetes. So these are different ways and means to test the artery circulation of the heart. Angiography is many times recommended. If stress test is positive, we may recommend an angiography and get to know the anatomy of the artery blockages. Okay. So now let's talk about prevention of heart disease in diabetes. The most important, I always say, the first medicine for all diabetic patients is good diet. Diet is your first medicine. Balanced diet. You need to understand what to eat, when to eat, how much to eat. All are important. Meal timings, meal amount. Of course, we always discuss what is to be taken, what is to be avoided. The simple plan is to reduce the fatty foods in the food, reduce processed food, reduce the salt in the food, oil and sugar in limit, everything in moderation. So a proper diet consultation from a trained nutritionist will really make a big impact. So diet is very important for managing the heart, diabetes, and also the weight. Second is exercise. Daily brisk walk of at least 30 to 45 minutes every day is going to, but again, this exercise should be done on a daily basis for long term. If you do for a month and 2 months and then stop doing it, it will not be of much benefit. But whatever plan you do, whatever exercise you choose, should be done for the long term. I would say lifelong. At the most, you need to do at least 6 days a week. You should be doing regular physical activity. In cardio, we call it aerobic exercise, is walk, run, cycle, swim. Many of the patients are doing Zumba. All these things help for cardio. You need to accumulate at least around 150 minutes per week of cardio exercise. Now we are also telling most of the patients to do some weight training, because the muscle mass starts going down in both men and women after the third or fourth decade. As the muscle mass goes, it is replaced by fat, so body becomes more insulin resistant. So some weight training, at least simple weights or therabands. Nowadays we get that rubber bands to do exercise. Simple resistance training for at least 2 or 3 times a week will also help to maintain the insulin sensitivity. So exercise is very important. Many people do, we see very good benefits with yoga and pranayam also. People may choose, but whatever you do, please do it for long term. So diet, exercise, and then medications. In medications, of course, control of glucose is important. It's the top priority in diabetes. The glucose should be in the range of fasting around 100, post meal around 140. 3 months average HbA1c should be ideally below 7. Now we need to have a systematic observation. So every patient should keep checking their sugars regularly, once in a month, at least once in 2 months, because again, as I said, diabetes is very silent. People don't realize whether their sugar is 100 or 300. They won't realize from outside. So keep monitoring the sugars. Whatever your doctor gives a schedule, keep monitoring, because these are long term issues and we need to have a systematic approach for long term. So keep monitoring your glucose, adjust the doses as needed. You need to meet the doctor regularly, because things keep on changing with time. As the patient's age, pancreas also ages. The same dose will not control lifelong. So at regular intervals, whenever the doctor calls you, once in 4 or 6 months, go and meet the doctor. They will adjust the doses for you, and they will also look for complications. In our practice, we also look for any silent problems happen, whether there is any problem in the eye, kidney, feet, heart. there are regular screening, at least once a year we test for these organs and try to detect a problem. So meet the doctor regularly, take your medications for diabetes on a regular basis. There are many new medicines in diabetes which are diabetes tablets, but they also protect the heart, protect the kidney. So a lot of new advancements have happened in the field of diabetes. And control of diabetes, then control of blood pressure. Again, diet for blood pressure will be reduce the salt intake in the food. We say 1.5 grams, not more than 1.5 grams of salt in it. That comes to roughly 1 tablespoon. Should not be a person should not be having more than that salt in the food. Reduce the fat intake in your meals. Deep fried food should be avoided. Processed food should be avoided. So all this diet, a good dietitian will plan for you. Control the cholesterol, that's very important, and statin is very important drug for control of cholesterol and also protecting the heart. Although there is a lot of wrong advice which is passed on through the WhatsApp, my suggestion is to stop blindly believing all the messages that come. Most of the doctors treat our parents, our relatives, friends with statins. They have been proven to reduce the risk of heart attacks. They are the most beneficial, most effective way of preventing a heart attack. So along with this, control of glucose, blood pressure and cholesterol. Avoid smoking. Smoking increases these blocks or the risk of these blockages by 5 times. Smoking increases risk of heart attacks by 5 times, increases risk of strokes and gangrene many fold. So we need to prevent all this. So smoking should be stopped in diabetes. No tobacco, no smoking in diabetes. So I think taking care of these important features along with a balanced diet and exercise will prevent a heart problem in diabetics. And of course timely checking and regular meeting your doctors and dose adjustment as needed should be the most important aspect in management of diabetes to prevent heart. Thank you.